Comparing the healthcare burdens in the USA, Japan, and Taiwan from chronic kidney diseases, CKD care linked to obesity and diabetes, using the viscoplastic energy model of the GH method. Math Physical Medicine. Number 1204, VMT Sharp 594, January 13, 2025. By Gerald C. Shu. Category CKD. Abstract. Key message. Among the three selected nations, the United States has the lowest healthcare burden for chronic kidney disease, CKD related to obesity and diabetes 127 or 1.0. In contrast, Japan 325 or 2.6 and Taiwan 315 or 2.5 face significantly higher burdens. This disparity arises from several factors in Japan and Taiwan, including higher CKD detection rates at lower BMI thresholds, greater prevalence of type 2 diabetes-related kidney complications, aging populations contributing to increased CKD cases, shifts toward Western-style diets exacerbating metabolic risks, extensive detection efforts through comprehensive national insurance systems. These factors collectively amplify the healthcare impact in Japan and Taiwan, compared to the United States. Brief introduction. This public health study analyzed the impact of chronic kidney diseases CKD influenced by both obesity and diabetes in three selected nations, the United States, US, Japan JP, and Taiwan TW over the period from 2010 to 2024. In addition to traditional statistical methods, the author also employed the energy model of the viscoplastic medicine theory, VMT, to uncover certain hidden biophysical phenomena. One key finding was the total VMT energy levels, which reflect the burdens or loadings on the healthcare system associated with the combined effects or interactions among these three selected medical conditions. Summary: average disease figures from 2010 to 2024, for the United States, Japan, Taiwan are: obesity prevalence rate, 39%, 4%, 22%. Diabetes prevalence rate, 10%, 8%, 10%. CKD prevalence rate, 0.321%, 0.395%, 0.359%. The VMT energy contribution ratios of obesity and diabetes to CVD in each nation are as follows. US obesity, 79%, diabetes 21%, obesity is greater than diabetes. Japan JP, obesity 33%, diabetes 67%, diabetes is greater than obesity. Taiwan TW, obesity 69%, diabetes 31%, obesity is greater than diabetes. These findings highlight distinct patterns in the biophysical energy contributions of obesity and diabetes to CVD across three different healthcare systems. The total VMT energy levels for each nation are as follows: United States 127 or 1.0, Japan 315 or 2.5, Taiwan 325 or 2.6. The following detailed descriptions provide explanations for the differences in healthcare system loadings or burdens among the three nations, the United States, Japan, and Taiwan. The differences in healthcare system burdens related to chronic kidney disease, CKD caused by obesity and diabetes among the three nations can be explained as follows. 1. United States 127 or 1.0, lower detection rates. The US tends to diagnose CKD at later stages, leading to fewer documented cases but higher treatment costs per patient. Focus on treatment over prevention. The US healthcare system prioritizes managing advanced conditions rather than early detection. 2. Japan 315 or 2.5, early detection and lower BMI thresholds. Japan detects CKD at earlier stages and at lower BMI levels, increasing documented cases. Aging population. Japan has one of the world's oldest populations, which significantly increases the prevalence of CKD. Dietary changes. A shift toward westernized diets has exacerbated metabolic disorders, contributing to CKD. 3. Taiwan 325 or 2.6, comprehensive health coverage. Taiwan's universal healthcare system ensures widespread CKD screening and early detection, increasing reported cases. Aging population and metabolic risks. Like Japan, Taiwan's aging population and growing metabolic disorders, including type 2 diabetes, lead to higher CKD prevalence. Western-style diets. Similar dietary shifts contribute to higher obesity and diabetes-related CKD cases. Conclusion: Japan and Taiwan have higher healthcare burdens due to their emphasis on early detection, aging populations, and the impact of metabolic disorders. In contrast, the US shows a lower recorded burden due to later stage detection and a treatment-focused system. Despite having a high prevalence of obesity and diabetes,